With an estimated 620,000 casualties, the Civil War holds the record for the deadliest war in United States history. The Civil War was one of the major events that has helped revolutionize the face of modern medicine. Civil War medicine expanded knowledge on subjects such as anesthesia, treating gangrene, as well as reconstructive surgery, the precursor to modern plastic surgery. In previous wars, the common practice was for the army drummers and musicians to retrieve the wounded, and military surgeons were assigned a regiment, and they could not treat anyone outside of it. However, this was an outdated practice, and because of the large volume of injured soldiers, military medical personnel decided to develop a more efficient system of medical care. Hospitals were established wherever space was available, in barns, homes of willing civilians, but most commonly in tents. The first field hospitals were often in the open air, on simple tables and cots. Hospital tents were a poisonous place to perform surgery. In the 19th century, the correlation between dirt and infection was not adequately understood, and surgeons did not make use of any antiseptics. To speed things up, men were lifted into carts along with other wounded men and transported to hospital tents in this manner. Also developed during this time was a far simpler version of the modern system of triage. The wounded were categorized into three groups: the walking wounded, the wounded requiring immediate care, and the wounded beyond repair. Those with mild injuries were given bandages and opium for pain. Those expected to die were given morphine and opium. Those wounded through the chest, head, or stomach were often expected to die and treated last, so that what precious time a field doctor had could be dedicated to those with serious injuries to their arms and legs. A new revolutionary bullet called the mini ball was able to fracture and shatter bones in just one hit. Rather than waste time wrapping and setting a bone, limbs were simply cut off. This proved to be far less time-consuming, and amputation saved many more lives than it lost. Amputations were the most common treatment performed in battlefield hospitals. 3 out of 4 surgeries were amputations. Contrary to dramatization about Civil War amputees, anesthesia was always used when possible. The anesthesia first and most commonly utilized was chloroform. After being anesthetized, a doctor would tie the limb tightly with a cloth to restrict blood flow. Then, using amputation knives and saws, a doctor would cut through the leg, tie the blood vessels, and then the wound was closed, and the doctor would move on to the next patient. Doctors assumed that infection was a normal and critical part of the healing process, even encouraging mild infection. Because of the overwhelming number of injured soldiers, the main priority in amputating limbs was not cleanliness, but speed. Surgeons did not wash their hands or instruments, sometimes for several days. This resulted in many infections, the most common being hospital gangrene. Despite these odds, about 75% of all amputees survived. The Civil War was also one of the first times that women helped the war effort in such a large volume. Women volunteered as nurses and became known as angels of the battlefield. It is estimated that over 4,000 women worked as nurses, most of them untrained. Union care was significantly better than care in the Confederacy. This was partially due to a lack of medical supplies in the southern states. Also, the Union had more established hospitals to begin with. The Union was also first to implement a successful transport and triage system. The Confederacy lacked enough space to care for every soldier, and so initially, wounded soldiers were sent home. By 1862, Union hospitals were strides ahead of Confederate hospitals. Union regiments were regularly supplied with medical books, hospital furniture, necessary instruments, and bedding. Unions mandated that every regiment have at least one surgeon and one assistant surgeon. This, along with the abundance of railroads, gave the Union a great advantage. Despite the ignorance about disease and proper medical care, the Civil War has played a large role in developing modern medicinal practices. For instance, Clara Barton, perhaps the most well-known volunteer nurse at the time, beginning her work as a nurse just 9 days after the war began, Clara organized the American branch of the Red Cross to aid not just soldiers but anyone in need of medical care. A less commonly known fact about the Civil War is that doctors sometimes performed cosmetic surgery on soldiers if they suffered facial damage. There are about 30 known recorded cases of reconstructive surgery. Because medicine during the Civil War was highly experimental, it was recorded meticulously, particularly the increased use of anesthetics and the large amount of amputations. The records of doctors and surgeons practicing at the time and the detailed accounts of battlefield doctors have helped modern doctors evolve safer and cleaner practices.
Since last I held your hand in